Webinars reveal the principles of using artificial intelligence systems to diagnose and classify human diseases. The principles of using automated systemic cognitive analysis of large databases of test results and patient anamnesis, presented in digital and linguistic forms, radiographs, images of the nervous retina, and histological analysis of tissues obtained by invasive biopsy or optical coherence tomography are outlined. The results of automated systemic cognitive analysis for diagnosing diseases of the heart, lungs, liver, kidneys, eyes, breast, brain tumors, and other organs were obtained using the IDOS intelligent system. The following topics are offered on webinars. 1. Intelligent system for diagnostics of the early stage chronic kidney disease. 2. Intelligent diagnosis system lung cancer. 3. Intelligent system for classification of heart diseases. 4. The automated system cognitive analysis use for the classification of tumors in human organs. 5. University of Wisconsin-Madison database mining for breast cancer diagnosis. 6. IDOS intelligent system for automatic recognition of human internal diseases. 7. Prediction of myopia in children of primary school age. 8. Identification of brain tumors by digitized parameters of magnetic resonance imaging. Where did the materials for the lectures come from? First, a study was conducted, as a result of which a retrospective training sample was created for this type of disease. A study was then conducted using models automatically generated by the IDOS system. The webinars are intended for scientists, teachers, students, and specialists in the field of information and intellectual technologies who study the use of artificial intelligence for diagnostics in medicine and other fields. Webinars are also useful for doctors and medical staff of healthcare institutions. Webinar participants will receive retrospective training databases for the detection of diabetes, glaucoma, diseases of the spine, breast, kidney, liver, lung cancer, detection of tumors in human organs and the risk of failure of liver implants. Upon request, webinar listeners will receive the IDOS intelligent system and educational databases for free on the types of diseases discussed in the lectures. Based on the materials of the webinars, you can conduct practical classes with students and prepare scientific articles on methods for diagnosing human diseases using an automated method. The lecturer of the course is Vladimir Ryabtsev, Doctor of Technical Sciences, Professor of Information Technologies. For 30 years he worked as an associate professor and professor at the Department of Information Technologies of the Cherkasy State Technological University and for 5 years as the head of the Department of Mathematical and Information Sciences at the Cherkasy branch of the European University. I know the author of this system, Professor Evgeny Lutsenko. We have joint scientific articles. The professor has posted the IDOS system on the internet so that you can use it for free. I taught students the principles of working in the IDOS system for 6 years. The experience gained helped me write articles on the use of artificial intelligence systems in medicine. I am reviewing some scientific articles. 1. Identification of brain tumors based on digitized parameters from magnetic resonance imaging results. Examples and Counterexamples, Volume 4, 2023. 2. The use of large databases for diagnosing human diseases at early stage. Indonesian Journal of Artificial Intelligence and Data Mining. Volume 6, Number 2, September 2023. 3. IDOS system prediction of myopia in children in early education stages. Journal Ilmiah Teknik Elektrokomputer dan Informatika. Volume 9, Number 2, June 2023. 4. Intellectual System Diagnostics Glaucoma. Journal Ilmiah Teknik Elektrokomputer dan Informatika. Volume 9, Number 4, December 2023. Sets of large databases obtained at webinars can be input data for the preparation of dissertations for masters and doctors of philosophy using the IDOS intelligent system. Based on webinar materials, heads of Centers for Innovative Development of Medical Faculties of universities and colleges can use the IDOS intelligence system to carry out scientific projects, for which they can receive as many grants as there are types of diseases people have. Incoming texts of the IDOS system, available on the Internet, can be used by IT companies to modernize and design their own artificial interface systems. IT companies will be able to implement new promising projects for their countries and many other countries of the world. To use the IDOS system, you do not need to buy a license. On-demand webinar listeners will receive the IDOS intelligence system with an English language interface for free. The IDOS system was developed in a domain-independent formulation and is successfully used to solve problems of identification, forecasting, decision-making and research of a modeled object by studying its model in many subject areas, in particular in economics, technology, sociology, pedagogy, psychology, medicine, ecology, ampelography, geophysics, entomology, forensics, and other fields. To diagnose and qualify human diseases, it is proposed to use the IDOS intelligence system. But the system itself, like any intelligent system, cannot do anything on its own at first. She must first be trained. Let's say we want to find out whether a person has the flu or not. Let's create one instance of the training sample. We note the following in it. A person has the flu if they have a high fever, cough, and runny nose. Then the user adds his entry to this selection. He notes that he has a high fever, cough, and runny nose. The IDOS system reports that he has the flu, and the degree of similarity is 100%. If he reports that he only has a high temperature and does not have a cough or runny nose, then the system will respond that he has the flu. But the degree of similarity is 33%. This is with one instance of the training set. But we can make 100 records in the training set. In 100 entries, we note that the flu occurs at high temperatures. And in only 10 entries we note that with the flu there is also a cough. And in only 10 entries we note that with the flu there is a runny nose. If we add another entry where we indicate that the patient only has a high temperature, no cough, or runny nose, then the IDOS system will respond that the patient has the flu. The degree of compliance will be 64%. Let's say we inform the system that a person only has a cough and runny nose, but does not have a high temperature. Then the system will answer that he has the flu, but the degree of compliance is -64%. Big data and artificial intelligence are rapidly transforming modern healthcare. The combination of these technologies makes it possible to collect, analyze, and use large amounts of health data in ways that were not previously possible. Although there are a number of challenges to overcome, the potential benefits of using these technologies are significant and include improved patient outcomes, efficient and effective healthcare delivery, and the potential to improve access and affordability of healthcare interventions. To implement projects in the IDOS system, it is necessary to develop training databases, and this is a very long and labor-intensive process. To determine the risk of stroke, I used a data set that was a 1000*10 matrix. It took 30 seconds to correct one matrix cell, and 5,000 minutes or 83 hours to debug the entire matrix array. Therefore, it is recommended to use representative training databases that I have already developed for the detection of diabetes, early kidney disease, liver disease, lung cancer, spinal diseases, detection of tumors in human organs and the risk of liver implant failure. Of course, you can try to learn how to work in the IDOS system yourself. But we do not advise you to do this, because there are so many possibilities in the system that you will simply get confused in them and waste a lot of time. Our lectures are designed to reduce your costs. As an incentive to attend webinars, upon your request, we can provide free training samples on recognizing a number of human diseases. Since the training databases are provided free of charge, we do not accept claims that they are imperfect. Use these settings as is or change them as you wish. The term cognitive comes from cognition, knowledge, English, and is used to denote a new direction in the development of artificial intelligence systems, cognitive modeling and system cognitive analysis, which implements the task of automating some functions that are performed by a person in the process knowledge. There are more and more sites devoted to artificial intelligence, databases for machine learning, UCI, Kaggle, and others, and even intelligent online applications are in the public domain, and the interfaces used on the Internet are improving. However, students and scientists still do not notice that an open, scalable, interactive intellectual environment for teaching and scientific research, based on automated system cognitive analysis, ASC analysis, which is performed in the IDOS intellectual system, has existed and operated for a long time. ASC analysis can be applied in all subject areas where a scientist or practitioner solves his professional problems and constantly improves his knowledge using the latest achievements in the field of artificial intelligence. The main conclusion: automated system cognitive analysis has all the main features of a new promising interdisciplinary scientific direction of the basis of automated system analysis. The IDOS system has 55 operating modes, so it is almost impossible to learn how to work in this system on your own. Any mistake you make will cause the system to stop or you will get incorrect results. If, without explaining the basic rules, you start studying several operating modes of the system per day, then in order to learn how to work in the IDOS system, you will need to spend several months. Lectures lasting 30 minutes each in English can be used to prepare dissertations in the field of medicine, information, and intellectual technologies. Preparing students' theses on artificial intelligence is a very difficult task. It is necessary to develop mathematical models and special software. At the same time, there is a universal intellectual system, IDOS, which has been successfully operating for 30 years. The IDOS system automatically generates 10 mathematical models and performs many research tasks in different subject areas. The UCI and Kaggle repositories have many databases for processing by intelligent systems. This is ready-made initial data for preparing many dissertations using the IDOS system, the preparation of which will become easier. Simultaneous translation of webinar lectures into Arabic is provided.